Hey everybody, Dr. Kevin again here, and welcome to day 4 of our Back to Basics Spine Rehabilitation Program, where over the next 30 days, I will show you how to create a comprehensive spine rehabilitation program from complete scratch, and with the hopes that it helps you increase your mobility, helps decrease just nagging aches and pains, helps you increase your strength, and what I believe are the safest, simplest, and most effective ways that we possibly can do within the tools that we have at our disposal. So today's topic is what I believe probably the single most important and most common problem that I see here in the clinic, um, and one that I think so many people are just so unaware of. But also, once we identify it as an actual problem, how easy it is to actually start to correct and start to fix, and also how important of a concept this is just for overall spine health in terms of one, reducing just overall aches and pains, especially in the lower back and especially in the neck and shoulder area, and one that will help you increase your posture, and one that will just help you improve the overall health of your spine and possibly prevent a lot of more serious conditions from happening in the future. So just to give you a little bit of context before we jump right in. Again, I own and operate a clinic out here in East Bay of California, and having worked in the Bay Area for the past 12 years, I've worked with thousands of people who work in tech. Again, these are people who are spending the majority of their waking day 8 to 10, in some cases even up to 12 to 14 hours, just kind of sitting at a desk, hunched over a computer screen. And by the time they're coming to see me, they're usually not coming with just typical aches or pains or just a little bit of tightness. They're usually coming in to see me with a more serious and more complex problem. For instance, for lower back injuries, I'm seeing people with really nasty sciatic nerve pain to the point where they can barely bend over. They can't even sit for more than 10 minutes. People that are diagnosed with herniated discs because of, or as a root cause of their sciatic pain. Again, I'm even working with 30 to 35-year-old new fathers who can't even bend over to pick up their own kids. Their backs are in such bad shape. And in terms of just neck and shoulder pain, like we're getting people that are coming into the point where they're having massive tension headaches to the point where they can't even concentrate at work for more than 10 to 15 minutes without just constant pressure or pain in the back of their head, just kind of radiating to the front of their skull. I'm seeing people that are coming in with severe shoulder pain or just pinched nerves in their neck or just shooting down their arm to the point where they can barely even sleep. Their hands are going numb. They're just getting radiating pain all the way down their arm. And if you ever had feelings of a pinched nerve, you just know that it's just one of the most uncomfortable, difficult things to deal with. And it's just, these are just, problems and conditions that I think could just be so easily prevented if people just had a general better understanding of how their spines are supposed to work, how their spines are actually supposed to move, and that it's actually quite simple, basic, and easy once you understand what you actually need to do to fix it. So I want to spend this video just kind of going over, again, what I believe is just the most important concept, especially if you're somebody who is working at a desk or just struggles with your overall posture in general. So the topic of the day and the direction of the movement that we want to take the exercises is known as thoracic extension. So let me repeat that again. So what we're going to be working on today is known as thoracic extension. So just to give you a brief review, if I just take my spine model here, we have 3 main components of the whole spine. We have the neck comprised of the first 7 vertebrae, known as the cervical spine. The next 12 vertebrae are known as the thoracic vertebrae, also known as the thoracic spine. And the last 5 vertebrae, which comprise of your lower back, are known as your lumbar vertebrae. So again, what we want to be working on today is known as thoracic extension, meaning that we want to be identifying and helping you improve the extension of the middle part of your back, so bending your spine back into this direction, okay? And so why is this such an important concept to go over? Well, it's because most people are unaware of the fact that they don't have or don't possess the ability or capacity to actually create extension throughout their thoracic spine because of the fact that they just spend so much time in a slumped, slouch, flex position that they don't even know that they've even lost the ability for their spines to move. And quite frankly, a lot of my patients are just unaware of the fact that their spines are actually designed to be able to move in that area. So we're going to go over, some of the most common ways where you can start to identify, one, if you have some tightness or restrictions in your mid to upper back, and if you're someone who is dealing with chronic neck or shoulder problems, or if you're dealing with chronic lower back stiffness, it's one of the things that we expect to be able to see. And these are some ways that we can actually start to work on fixing them. Again, from the comfort of your very own home, with just a couple of just basic tools and a couple of basic exercises that you can do that I'm about to show you right now. So let's get right into it. Okay, so let's get into the first exercise. And again, as much as I want to keep this program as simple and not needing any equipment, I think that we can make an exception for this this one piece of equipment here, known as a foam roller. What I have here is just a high density black foam roller. You can pick this, something like this up on Amazon for no more than 15 to 20 bucks. This is just, again, one of my favorite tools that I've had over the past 12 years in working on my own spine and just trying to preserve and maintain my own mobility. And one of the tools that definitely helped me get over some pretty nasty neck and back issues myself, and a tool that has helped a lot of my patients throughout the years as well. So again, very, very important tool, and we'll show you how to use it in the most effective way possible. So again, the theme of today is based around this concept of recreating this movement called thoracic extension, and that most people have problems with this issue just because of the fact that they spend so much time with their mid-back in a flexed, also known as a kyphotic posture. And this is what I believe is at the root of so many issues that people have with their posture, and also one of the reasons why they struggle and deal with so much chronic lower back and chronic neck and shoulder pain, just because of the fact that they are unaware that their spines are stuck in this position. They're unaware that their spines are actually designed and built to be able to bend backwards like so, and the fact that they don't even know what to do about it, even if they were to identify that as a problem. So this exercise and this roller helps us kind of just check all the boxes, and one, helping you identify how stiff you actually are in that area, and two, it'll also help us start to make slow and steady improvements in that direction, which again will help you improve your posture. It'll help take some pressure off of your neck and your lower back, and it's also one that's going to help you increase the overall levels of awareness and connectivity to your spine, especially in an area where people just seem to be lacking so much in today's society. So very easily, very, very simply, all I want to do is just lay on the roller. And all I want to do in the beginning is just maybe just roll up and down my back a little bit. And again, my goal is to just try to keep it in the mid-back area. I want to be careful not to go too low into my lower back, because that can start to increase a lot of strain, a lot of pressure down through here. So I really just want to focus on just the mid to upper area, just as I'm doing right now. Okay, we can go all the way up to my base of my neck, right kind of where my shoulder blades end, and we can just kind of go all the way down to about here, right around kind of where my shoulder blades end and where my ribs start to end, right around here. So any lower than this, again, this is going to be a little bit too much pressure on the lower back, and it's just something that I don't advise. We just want to kind of stick to this mid to upper back region through here. Okay, and the first thing you can do is just kind of what I'm doing right now. It's just kind of just roll up and down and just start to just get a feel for how tight or how stiff or how just kind of knotted up those mid to upper back muscles actually feel. Again, a lot of my patients just haven't really paid a lot of attention to this area, and sometimes in the span of years. So they're just a little shocked, they're a little surprised, and just at just how tender and tight and how sensitive these areas of your body can be. But that's the intention, okay? Just a couple more, just kind of rolling up and down a little bit. And then I'll just kind of park it right in the middle here. All right. So again, the theme of today's exercise is to help you identify and increase this thoracic extension movement, which means that I actually want to bend my spine over the roller as far as I can. okay, like so. And if you see, for me, I have the ability to actually bend all the way down over the roller to the point where my head is actually able to touch the ground. That's because my spine actually has the ability and capacity to bend and extend all the way around through here. For most of my patients, especially the ones that work over from computer or just struggle with their posture, as they bend backwards, they're going to get stuck right along here just based off of the fact that their spine just has lost the actual ability to actually move, and that they're just unaware of the fact that their spines are designed to be able to move backwards. Okay, so if this is you and you're starting to just kind of bend back over the roller, again, I would also advise that you just put your hands behind your head just to support your neck. Then just bend back over as far as you can, and at some point you might get stuck. You might feel a little bit of tightness, you might feel a little bit of pain, a little discomfort in that area. And as long as you feel it along the mid-back area, then that's fine. Just stay right there. And just like with all the other stretches and exercises that we've done thus far, just take a nice deep breath in. Exhale. Just go as far back as you can, like so. Another deep breath in. Exhale. Don't force it. Just let gravity just kind of gently pull your spine, just pull your back backwards over the roller. And one more time here. Breathe out. Just go as far as you can. If you start feeling pain in the back of the neck, then you might be going a little too far back, or just make sure that you're properly supporting the back of your head. If you start to feel a lot of pain or a lot of pressure in your lower back, that means you're probably trying too hard to arch from your lower back, to try to keep your lower back a little bit flatter, and just try to focus on trying to create a backward bending movement just right in the air where the roller is, and just trying to create as much extension through the area, almost like you're trying to just wrap your spine around the roller just like a snake, like so. Okay, again, for me, since this is something that I've been working on and have been trying hard to maintain over the years, I have the ability to wrap my spine over the roller. But again, if you get stuck, if things just kind of get a little tight, then just stay right at that point, take a couple of breaths, and again, just use your breathing to guide yourself down. Like so. One more time. Okay, so that's how we can at least start to, one, assess to see, does your spine actually have the ability to bend backwards, and two, to use this roller as a means of helping you increase the mobility if you find yourself getting a little tight or getting a little stuck. Okay, now there's one more very, very important part that I want to make about this exercise. Now, I was working on what I would say the middle part of my thoracic spine. And also remember that there are 12 different vertebrae along my mid-back. So I was working on the middle part, but what I'm going to show you next is just to make sure that we're very comprehensive with the stretching. We want to make sure that we're addressing all parts of the mid-back, again, just to improve our overall mobility and overall functionality of our spine. So instead of just in the middle here, the next repetition I'm going to do is I'm going to move the roller up my back towards my neck, not on my neck, but just kind of on the tops of my shoulder blades through here. Again, I'm going to be working here on my upper thoracic vertebrae, and I want to do the same exact thing. Just bend backwards over the roller, get to a point where I feel like I'm starting to get tight or get a little stuck, or things are just getting a little stiff. Take a nice deep breath in. Exhale. And just go back a little further. What a lot of my patients may find is that they have more mobility in different parts of their mid-back, but have less mobility, let's say, in their upper back or their the lower part of their mid-back. So you want to be spending a little bit more time and attention on the areas where you feel a little stiffer and a little tighter. And again, if you have a lot of neck or shoulder pain, that this upper part of the mid-back may be the area where you need to spend a little more time. Okay, So from here, I'll take another couple of deep breaths in. Exhale. Just bend a little further. Again, not forcing anything, just letting gravity just kind of, and my breathing just kind of dictate how far I can go. Again, not pushing through any pain, not pushing through any real serious discomfort, especially if it's coming from my neck. Again, if you're just kind of feeling a little bit of discomfort, a little bit of stretching, a little bit of sensation in the mid to upper back around the area where the roller is, that's completely fine. That's what we want. One more breath in. Exhale. And just go as far down as you can. Okay. Now the very last part, again, so the first part I did was the middle part. The second part I did was the upper part. Now the last part I want to do is just these lower 4 vertebrae through here. Again, I just want to make sure they're not going too low onto my lumbar spine, because that's going to create a lot of pain, a lot of pressure. So I still just kind of want to stay right around the bottom of my shoulder blades, right around the area where my rib cage kind of ends. And it's easy to know if you're too low, because you will start to maybe feel a bit of uncomfortable discomfort in your lower back. It means you're probably a little bit too low, so just move the roller up your back a little bit, just to around here. And I'm going to do the same thing. I'm just going to bend back over the roller. If you get stuck, if things get tight, take a nice deep breath in. Exhale. Hold it here for a couple seconds, so that you just give your body a chance to just kind of settle into the stretch. Another breath from here. Exhale. And one more time. Breathe in. Breathe out. Then a little further towards the ground. Okay, so that's it for the foam roller exercise. Again, I'd advise that you work on all 3 parts of your mid to upper back. So you want to work on this area through here, which is what we call the upper thoracic spine, which are the first 4 vertebrae of the 12 vertebrae of your thoracic spine. The second area, you want to work on the next 4 here, which is the mid part of my thoracic spine, which is going to sit right between your shoulder blades. And then you want to be working on the last 4 vertebrae through here, which again just kind of sits a little bit lower. Again, the idea behind this is because so many people that I see that are struggling with chronic lower back or chronic neck or shoulder pain is just due to the fact that they're spending so much time of their spine stuck and spent in a flexed, rounded, kyphotic posture, and they're just unaware of the fact that they have lost the ability for their spines to actually bend and move into this direction, which is why they struggle with their posture just not getting any better. But when we start to increase the ability for your spine to be able to move, that's going to unlock so much more in terms of muscle activation, in terms of overall biomechanics and alignment of your spine. It's going to help just take a lot of pressure off of your neck, and it's going to take a lot of pressure off of your lower back once you actually start to make some gains and start to make some improvements in this area. So a little bit of a longer video. And after this, I'm just going to show you a couple of variations that you can get started with in the event that you don't have a roller, or if just getting down onto the ground and doing this exercise just feels a little bit too challenging or a little too stressful. I'm just going to show you a couple of ways where you can start to still gain the benefits from this type of exercise in a way that's going to be a little bit easier on your back. Okay, so let's move on to the next thing. Okay, so here's the second exercise that you can do to help you increase your thoracic extension mobility. Again, to help you increase your posture, increase your overall mobility within your spine. And this is in the event that you don't have access to a foam roller, or if you're in a position where just kind of getting down to the ground and just bending back over a foam roller is just a little bit too strenuous, a little bit more difficult for you at the current moment. So just wanted to give you a couple of alternatives where you can start to still make some improvements upon what I believe is one of the most important things and one of the most important concepts that I hope you take away from this whole program, which is just to identify and improve any restrictions you have in this movement called thoracic extension. So again, in the event that you don't have a roller, we can just kind of use a chair, and hopefully one that has a sturdy enough backing to the point where it's going to give you a little bit more of a protection to try to just kind of arc and bend over the roller or over the chair. So here, again, if I don't have a roller, I can just kind of use a chair and going to just put my hands behind my head to support my neck. And from here, I'm just going to start to extend and bend back over the roller as far as I can. Same thing, once I get a little tight, once I get a little stiff, once I feel a little stretch, I'll take a nice deep breath in, breathe out. Still feel a pretty good stretch. Not as targeted as the roller, but still way better than just doing nothing. Okay, nice deep breath in. Exhale. And one more time. Okay, so obviously with the roller, I can roll it up and down my spine, which allows me to work on the various different segments within my thoracic or my mid-back area. So how do we accomplish the same with the chair? Well, all you need to do is just stack a couple of cushions or a couple of objects underneath on your seat here, just to change the position of your spine. So here I've just kind of used this sturdy blue pad here, and this will help me target it a little bit lower on my spine, like so. Same thing, just bending back, right about here. I'll take a nice deep breath in, exhale, bend back. Again, if you start to feel a lot of tightness or pain, especially in this like lower back area, you might be a little bit too low, or you might need to just kind of secure your lower back better onto the chair here, so you're not getting too much back bending from your lower back here. So again, I really want to make sure that I'm only targeting and feeling a stretch in the mid part of my back, right around the area where I'm bending from. Okay. Breathe in. Breathe out. One more time. And breathe out. Just make sure you're not bending so far back over the roller to the point you might tip over. But again, if you're really stiff, if you're really tight, you're probably not going to bend back as far as I'm able to. Again, if you want to target the upper area, just remove the cushion just to position your spine a little lower in the chair, and maybe just kind of slouch in the chair just a little bit, just so that we can get a little bit more pressure in that upper back area through here. Same thing. Hands behind my head to support my neck. Use my breathing, as always, to guide me into a deeper stretch. Okay, still pretty effective with this chair. Definitely better than just kind of if you don't have access to a roller, or if you, again, just are still a little hesitant to get on the ground and to use the roller. Definitely a good alternative, a little less effective, but still definitely worth it. So let's move on to the third variation of how you can start to improve your thoracic or mid-back extension. Okay, so for the last part of day 4, we're just going to be revisiting an old friend of ours, which is known as the cow stretch or the cow exercise. This is something that we went over on day 1. And I think it's worth repeating because I think it fits just very easily into the first exercise that we showed you, which is to help you increase your extension or back bending movement in the mid to upper back over a roller or over a chair. This is one, again, that you can do if the roller is just a little bit too challenging or a little too difficult for you right now, or if you don't really have good access to a chair. Or it's also good to do after you've done either one of those first 2 exercises, just as a means of helping you cement and just further help create more permanent and positive changes in the area to, again, help you increase your mobility, improve your posture, and just improve overall the health and mobility of your spine. So let's get right into the exercise again. So again, just as a reminder, this is one that's done on your hands and your knees, and we're going to be focusing on creating a backward bending curvature in this middle part of my back. Very common mistake that people make is they will extend or create too much pressure upon their lower back, which just is something that we want to avoid. So what we rather do is just focus our attention and our effort on this mid to upper part of our back. And we can do that by just having you simply just drop your chest and making sure that you're not bending too far from your lower back through here. Okay, just like so. Just dropping my chest, dropping my ribs. And how you know you're doing this right is if you start to feel a lot of stretching or a lot of pulling or a lot of just maybe a little bit of a tightness or just some activation of some of the muscles or some of the joints along this mid part of the back here. That's how you know you're doing it correctly. So I go down as far as I can, and then once I get down to the bottom, I want to stick at my chest, lift my head up just a little bit, and just hold that position and breathe for a couple of breaths. Exhale, sink into a deeper stretch, sticking out my chest, lifting up my head just a little bit. Again, really focusing on making sure that I feel a lot of the activation and just a lot of the stress happening in this middle part of my back. If you start to feel a lot of pressure in the back of the neck, or if you start to feel a lot of pain in the lower back, just try to reset a little bit. You might be getting a little bit too far. You might be getting a little ahead of yourself, and just try to see if you can just center your attention and your focus on this middle part of your back, trying to create a dropping of the ribs and just a little bit of sensation of your spine just kind of bending backwards to that mid part of the area, to the mid part of your spine. All right. One of the cues that also seems to help a lot of my patients is just imagine someone has placed a ball or some type of object on the middle part of your back, and you just want to simply just try to see if you can wrap your spine like a snake around that part of your upper back, just to create that curvature through here, like so. Okay, making sure that I'm not dumping or putting too much pressure in my lower back. I'm just kind of shifting that attention and that drive into my mid to upper back through here. Okay, dropping my chest, dropping my ribs, and then opening up my chest at the top. Take a couple of deep breaths in. Exhale. Try to maximize the backward bending curve in my mid to upper back through here. Like so. One more breath. Okay, so that's it for the 3 exercises or 3 drills to increase thoracic extension. Just to recap, I think that this is probably the most common problem that I see in almost 90% of my patients, and one that if we can start to identify, start to correct, and start to improve upon, this is one of the things that will help prevent a lot of unnecessary lower back pain, a lot of unnecessary neck or shoulder pain, and one that is very easy to do once you identify the problem and just work on some of these movements. So that's it for day 4, and hopefully it helped. Hopefully it's definitely a little bit more challenging than the last exercise video, but it's one that, again, if you just start to get used to, if you just start to work on very slowly, one that will pay dividends for you moving forward. So can't wait to see you on day 5. Have a wonderful day.